Hi there, my name is Cathy Erin, and I am a holistic empowerment and mindset life coach. And I want to welcome you to another series of Unleash Your Potentials. Discover how health and wellness can increase your confidence, inner self-worth, improve relationships, and live that life you love. Before I introduce you to our next guest, let me read you a little bit about her bio and history. Dr. Erin Holston Singh has been in private practice since she graduated from the National University of Natural Medicine in 1998. Her clinic in Cleveland Heights Option Naturopathic Clinic serves patients near and far through direct care and web consults. She's founding president of the Ohio Naturopathic Doctors Association and continues to work towards bringing naturopathic medicine to Ohio, being the first licensed naturopathic doctor to set up practice in this Midwestern state. She is trained in Gestalt therapy, which has enabled her to master the art of training and what is really significant and necessary to explore each person with whom she works. The German New Medicine and Recall Healing also contributes to her medical worldview and assessment of each patient. Combining all these perspectives, Dr. Erin has a particular focus on the developmental and emotional relationship to the pathology in her clinical work. At the root of this critically important therapeutic philosophy is her extensive study with Dr. Gerard Guéniot, a renowned teacher of natural medicine in France and Belgium, and I hope I said his name right. But without any further ado, let's introduce Dr. Erin. Hello, Dr. Erin.
Oh, hello. So just to say Dr. Guéniot's name right. Guéniot.
Guéniot?
Guéniot. It's a strange spelling, but it's French. What can we say? So
right. Well, thank you for clarifying that for us.
Yeah. Should have talked to that earlier, but didn't think of it. So thanks for having me. I'm very happy to be here and share so much of what I've been learning and how I got into all of this. It's been a very long time that I've been thinking and reflecting and searching and trying to figure out everything we need to know to understand why we get sick and why we don't feel well. That's what I've dedicated my life to.
And that's a very important piece, and we're so glad that you are doing that for us. Thank you so much. So let's begin with your story and how you got into naturopathic medicine.
So I was a pretty young person when I started guessing started second guessing what the doctors were advising that I do for my own health. I had asthma as a child and was just being told to use stronger versions of corticosteroids. And by the time I was probably 8, 9, 10 years old, I was thinking, this doesn't really make a lot of sense. Like, the doctor tells me the exact same 3 things every time I go to the doctor, and it doesn't really help the problem unless I use these drugs, these creams, these ointments. And then when I started reading about them, by the time I was in high school and college, I got pretty upset to learn what the negative effects were on my adrenals and thinning of the skin and these kinds of things. But then I'd also had a pretty profound experience with my mother, who, when I was 15, was misdiagnosed as a schizophrenic. When she did not have schizophrenia, she had a degenerative neurological condition. And it took, the rest of her life, over 17 years, for us to really fully understand what had happened and what had contributed to her disease process. And I think there was something in me that just always thought that her childhood experience, where her mother had died when she was 8, and then she was kind of shipped around from alcoholic father to grandparents to alcoholic father to grandparents, I thought, that has to have had some pretty profound impact on her. And it was just always something that I thought about, and then tying that back in with my own skin issues, I always felt like I always try to take it as a benefit or a blessing that when there's something was wrong with my body, I had an immediate sign, which a lot of people don't get. So a lot of people don't ever even know they're sick until they're diagnosed with stage 4 cancer. So I always try to take this information as a blessing because it was a teacher for me. And, of course I struggled with it for many years until I, could really understand what it was about. That's what really led me on my path around the psychological relationships to disease. And it's just helped me clarify so much.
So are you saying your skin disorder would pop up or become even more extreme when something was wrong?
Oh yeah. I mean, I think most people probably notice. In fact, the way that I hear patients talk about it all the time is, oh, well, when I'm stressed. So this word stress, which was actually coined in the 50s, people don't even know that that wasn't even a word before the 50s. But what is stress? Stress is whatever is coming at us that we're not able to accept or take in or manage, something we may be getting upset about, and we're not able to speak to it. So stress is a very generic term, but what I like to do is really hone in with my patients on what does that mean for you? What stresses you? What do you mean by stress? And I really explore it with them, because once a person has more awareness, more self-awareness, then that gives them the tools to know how to change and how to shift and how to move their perspective to something else that really allows their experience to be different. But if they don't even know that what it is that they're calling stress, they're just in a state of heightened cortisol all the time and driving inflammatory processes.
Yeah, that's a good way of putting that. And that is valuable, because a lot of people do say, I have stress, but they don't know how to manage it or what actually is causing their personal stress. So thank you for clarifying that. What about, how did you get interested then in the Gestalt therapy? Is this how this, go ahead.
I was very fortunate to actually work for a family. In fact, I was kind of thrown into the midst of their world because I lived with them the year between college and naturopathic medical school. I lived with a family who was instrumental in getting the organizational side of the Gestalt Institute of Cleveland started, and have been doing, teaching and training in Gestalt for many, many, many years by the time that I met them. Now that was 26 years ago now. So I got into Gestalt because they encouraged me to just do an introductory workshop. So I did the introductory workshop, and then I was living the Gestalt experience by living with these people who, I always think of that as one of the hardest years of my life, because they really held me more accountable than my own parents ever really had, and kind of pushed me into having more self-awareness than my own family had ever really known to encourage me to have. And there's something in Gestalt therapy called the cycle of experience that's a bit of touching on what I was saying earlier around a cycle of experience really starts when you first have a sensation. You have a sensation of, a pit of anxiety in your stomach, or you have a butterfly or something of anything. It could be anything. And what you do in Gestalt is you really kind of hone in on, well, what is that? And you go into it and you blow it up and let it become bigger. And then that's what allows it to shift. So it's been one of my greatest teachers, because I've really helped people to understand that the more you try to stuff your anxiety, the stronger it's going to get. But if you can allow yourself to move into your fear and your resistance and not be so afraid that your anxiety will swallow you whole, you can make progress and help to get through it. And you might need some more support. You might need a loved one or a therapist or someone to be with you when you do that. But this method in our conventional mainstream system of medicine that says just take these drugs when you have anxiety, but never explore the why and the source, I don't think it ever goes away. So, anxiety usually is because there's some issue or something that's unresolved that really needs to get released from the physical body. So I don't think we can separate the mind from the body. We use all these terms and we give lip service to this, psychosomatic, this and that. But the reality is the mind is the body is the mind, and they're inseparable. And we have to start to recognize how we deal with both. It's really, it's completely interconnected.
So the mind and body are definitely connected. And when we have a sensation, especially like anxiety, all of us need to be more aware of what is the root cause of that and how can we move through it instead of stuffing it. Is that what I get?
Yeah, I mean, and there's so many wonderful tools that we all have available to us for
Yes.
that. I mean, beyond even talk therapy, we have a lot of self-reflection tools. We have different types of body work that facilitate that. Craniosacral therapy is one of my favorites. Somato-emotional release is, a part of that. There's just so many different types of things that have come into the modern day practice that therapists and healers have brought about. So I really try to encourage my patients to use these tools, because sometimes it's the most important thing to really let them release old traumas and old experiences from the physical body.
That is important. Thank you for doing that work. So from there, were you led into spending time with your mentor in France?
So Dr. Guéniot, I met him on a trip to Belgium the year that I graduated from naturopathic school in 1998 with a group of other physicians that went over to the Unda laboratories in Belgium. And the person who owned that company was looking for someone to teach about homeopathy, to teach about these Unda numbered compounds. And so she had been kind of searching for someone probably out of Europe who was teaching this kind of different way of thinking about things. And so when Dr. Guéniot lectured for the first time, we all just fell in love with him because he was a true seeker. He was a very spiritual person, and he was essentially had been looking to understand humanity from the perspective of medicine, and was throwing out what didn't make sense and fit in with the philosophies that mirror nature. So he was, even though he was an MD by training, he essentially, as soon as he was done with his classical medical training, he shunned all that and studied homeopathy. He studied Chinese medicine, acupuncture, anthroposophical medicine, as well as many of the varying types of spiritual orientations. So he was a very true person, and he didn't have the kind of ego where he just was dismissing his students in a way that wasn't really trying to help you see what you needed to see. So he had a beautiful way of kind of an oral teaching that was very rarely recorded or even written. But I listened to him year after year after year, and he made sense to me from day one, because he was saying things that I always knew innately to be true with respect to how we use natural medicine, but not the things that shut down our biology. And a lot of things that weren't quite even adopted by the naturopathic profession, and maybe even today aren't, like, for hormones, for example. So Dr. Guéniot was a very adamant advocate that hormones really should not be used in medicine unless it was absolutely, absolutely necessary. And moving away from that was really a wise thing to do, because what you were doing was overwriting the body's own sacred messenger system. So he talked about hormones as being the sacred molecules, because they get secreted and then they go through the body and they have an action on almost all the tissues. But when we use these synthetic hormones, and I would say things like steroids and prednisone are the worst of that whole spectrum, is the reason that one is the worst is because the body really doesn't have any choice in responding to it. It overrides the body. And now we know, when we look at the literature, how dangerous these drugs are, but yet they're still used because there's no real respect or really there's no respect for understanding what it does, but it's also that the conventional docs don't know what else to do, right? They don't have anything else in their tool bag, and you got to do something. So just give them steroids and don't think about it. But, what Dr. Guéniot would do was he would understand that a person today is the result of every experience emotionally and physically and medically that they've ever had. And that perspective of understanding that you're the result of your past, and how do you pull yourself out of your past and in order to change your future, but all you have is the here and now. So he really just had a worldview that fit with my worldview and with what I really believe are universal truths and universal laws, and that which I think we're finding now that people are coming back around to. And a lot of people have always had that inherent sense that, I don't take drugs, or I eat organic. And, we know these things, but yet the convenience of life wants us to kind of disregard it or forget how critically important it is. But he never did. And so I held tight to him as a teacher for as long as I could. And unfortunately, he passed in 2011. And it's taken me some time to find someone else that I could learn so much from.
Okay, thank you for sharing that. It sounds like he had a profound experience on you and a profound experience on everybody who worked with him. So thank you so much. Did he have, or I'm just speaking out of term here because I'm not sure where the German New Medicine and Recall Healing comes from. Did he have?
Well, it's funny because I found out about the German New Medicine actually when I was in France on like a meditation retreat with my spiritual teacher. This was probably in like 95 or something. So I was still in medical school. And a lot of people, I think a lot more people in Europe knew about the German New Medicine because it came out of Germany originally, where Dr. Hammer was from. So I had someone from France tell me about it, and they were explaining to me the issues with skin. So skin is considered to be a conflict of separation. And I thought about that a lot because I knew that one of my emotional issues, if you will, was sort of this experience of being left or sort of being not so much, abandoned, like, left on a doorstep or something like that, but more kind of emotionally not always tuned in to the people who were caretaking with me. So this is what I've kind of figured out over the years of reflecting on this, but the concept fascinated me. And so I started to look into it. And then it was one of my trips up to Canada when I was going to study with Dr. Guéniot that I found one of the people who Dr. Hammer had known and had given her a lot of his materials. He was actually in Canada at that point, after having moved around a bit. And so I was able to get some of his literature, so his charts and his books that detailed how when he researched different patients who had cancers, he would do MRIs on them at varying stages and see different swellings in their brain that he mapped out to different locations in their body, and then to what the probable topic of the conflict was. So he had done this extensive work. That's what the German New Medicine is. And I, really started to pay attention to that when I would see patients and have cancer patients, but I knew it wasn't the complete answer. It was sort of like the why of the programming of the psyche, but then there was still the terrain and the body and the physical being that was being acted upon by both the emotional piece as well as what was going on a nutritional level and toxicity level. These things, so they're really interconnected, but we separate them out for intellectual purposes. So Dr. Guéniot mentioned Dr. Hammer, but I had already known about that work and had been learning about it and trying to find information on it. And then in more recent years, I found some other people who have taken that work into other methods, and that's the recall healing. That is Gilbert Renaud, who's another Canadian who has taken that work and put it out there. And he's someone that you can find on YouTube, and he's put together a book that he and other therapists have found to be another way of explaining those conflicts and how we resolve it. So I tie that in with the Gestalt and the self-awareness and how we can learn about ourselves to recognize that sometimes our disease manifestations are really, I mean, I say sometimes, but in most cases, I think that our disease manifestations are a reflection of underlying, very deep-seated and maybe even ancestral experiences, projections, conflicts. So it's really a whole realm unto itself. And there's some really great people out there doing work in only that realm specifically. And sometimes I refer my patients to those folks if that's really what they're struggling to see. But a lot of times it may even just be a referral to someone to do some of the body work and let it be released. But it all falls back on that self-awareness in one's own process and in their own history and their own developmental process. Go ahead.
I love that. So you integrate the Gestalt and the German New Medicine and the recall healing along with your practice. That's awesome.
Yes. So I would love to actually share with you another tool that ties all this together. That was Dr. Guéniot's sort of body of work. He and his colleagues put together a protocol that he called the brain protocol. And I have been using this protocol for over 20 years now. And I actually think it would have made a lot more sense to just sort of call it like an optimizing development protocol or something. But it's essentially a way of mapping together the brain tissue, the gut tissue, and the endocrine tissue. So again, those glands and those sacred secretions. And what I essentially learned from Dr. Guéniot is that it's those glands and sacred secretions that are driving and connecting the rest of our development. But when we have traumatic events, which frankly all of us have, it doesn't have to be rape or incest, even though we see a lot of that. It can be anything that's perceived as traumatic that can create a little hiccup in our development. Mm-hmm. It can block or stop or frankly just make it less than optimal. Those connections that happen as the brain and the gut and the endocrine system are all forming in sync with one another. So the brain protocol takes us through 3 phases of development, and there is a 4th phase that corresponds to puberty, but I generally just start everyone with the first 3 phases. And when I say everyone, I don't do this on all my patients. It's indicated at some times, but it's something that can be used also as an awareness tool, but it is also something that can facilitate a discharge and detox in the physical body because of what gets locked in the tissues when we're having these emotional experiences in life. So the protocol is essentially homeopathic, and it's made with what we call organotherapy. And organotherapy is a type of homeopathy where you essentially, the remedies are made from the glands or the organ or the nerve tissue from an animal. So for one animal for multiple years, this isn't, and it's not the same thing as taking glandulars or, what is also known as protomorphogens, or eating organs. It's literally just the energetics of that. So homeopathy is a whole nother topic, but it's a type of vibrational medicine. It's essentially information. So you're giving the information to the body and letting the body's vital force respond to that information. And when we give it in concert with one another, these 3 parts of the body and then a supportive mineral, and then we do it sequentially based on the development. So the first year of life, the next 6 years up until age 7, and then the next 5 years or so up until age puberty, 5-6 years. That can help reset a person's traumatic upbringing. It can help reset when we see someone has a tendency for autoimmune disease. It can help trigger some very subtle detoxification And in general, it's really a beautiful way of supporting self-awareness and the blockages and the gaps in our development that we had from birth until puberty. And then it can be a wonderful way to regulate adrenal, thyroid, the various sex hormones. So it's just one of so many tools that we have. So I don't use it on everyone, but there usually comes a time when it becomes, quite obvious to me that this is something that would really help this person and really shift where they are, or how they may be stuck, or how they may be having a lot of anxiety and needing emotional support. And we usually will do it 3 to 6 cycles and take a rest, see how they do, and maybe do it longer, maybe do it once annually just to kind of reset things. It's really been a helpful protocol with folks who are addicted, because there's a lot of pre-verbal trauma and abandonment. And then I usually use it in concert with other homeopathics that are a lot more specific to that person's experience. So the brain protocol can really be done by anyone. There's, the only caution that I would give people is to just be aware that you can have, like a detoxification symptom. And sometimes that appears in the guise of what we would call an acute infection, like, you get a cold or a flu or a sinus infection, but it's really just something from your past that's coming to the surface. So in my practice and in my teaching with my patients, I would never advise that someone use an antibiotic in that moment, because it's really just your microbiome shifting. That's actually one of the other gifts that the German New Medicine has given us, is that our microbes are really around shifting out what needs to come out of the mucosa. It's not that we are sick because we've acquired a bacteria. We always have bacteria around us, but we have some pathogenic and some not. And those considered to be pathogenic or causative for an infection are really our little friends who are trying to repair and discharge and help heal what has now come to the surface. But we've made a very significant mistake over the last 80 years since we saw these miraculous changes with penicillin, thinking that the microbes were the problem, when the microbes were really just the acute healing process. So this is, again, really where we have to fall back on our naturopathic and natural medicine philosophies, because it helps guide us to know what's truth. And what I'm loving right now is all this fascinating science that's coming out about the microbiome, and I think we're going to be seeing more and more and more about it. And I'm really excited to further tie all of that into all of this work.
Me too. I think that's exciting. So I'm going to recap on the brain protocol. Where can they go and find out more information if they're not under a care of a naturopathic doctor? And it sounds to me like I want to encourage everyone that they should follow the guidance of their health team professionals when they do seek out the brain protocol. But maybe there's a book that they can learn a little bit more about it.
Well, there was one book that Dr. Guéniot's colleagues put together of his work after he passed. I don't actually, unfortunately, there's a little bit in there, I think, about what they call maturation. That's kind of was his word for this whole, how he taught about it. There's not a whole lot on there. I do have a lengthy article on my website about it. I actually have a whole training course for therapists and physicians. And we do have the brain protocol on our website with like a downloadable PDF that you can offer to your summit guests, where they can learn, they can read the article, learn a little bit more about it. But there's not a lot written about it in English, because Dr. Guéniot was a French speaker. Okay. So this article that I have on my website is one of the few things that you'll probably find about it. And then this longer training course that I've created for professionals.
Wow. Well, I'm glad that you shared that with us. That's good to know.
Okay. I forgot about that too. Yes.
You have helped over hundreds of patients with their chronic illness and have optimized lives. in the past 20 years. And I'm curious, who are your patients? What kind of patients do you treat?
Well, as I always tell people when they ask me that question first, it's really everyone from preconception to death's door are the gamut of people that I work with and I see. Because in this kind of holistic medicine, we don't really specialize and say, well, I only treat this and I only treat that. But when you get down to the nuts and the bolts of the patients and who I see today, I mean, I'm currently working mostly with cancer patients, and that is, I'm going to say, the fault of, I'm kidding a little bit, but that is a lot of, because of Dr. Nasha Winters, who I think you also interviewed for this summit. She is definitely someone that I consider as a mentor for me, because she had to figure out even deeper what I had to figure out because of her own personal journey with cancer. And so she had dove quite a bit deeper into all of the specifics around the laboratory work, and was working with, very, very seriously ill patients. And so now that I have been, working and studying her work for the last 4 years, I see largely cancer patients, but definitely, anyone with mental, emotional issues, gastrointestinal issues, autoimmune issues, any of the chronic diseases, diabetes and cardiovascular disease. I see all of these things. But definitely I end up seeing a lot more cancer patients because they're finding me, because I think it's because I have a greater capacity than I used to really help these people. But I don't really ever turn anyone away. I have another doctor in my practice now to help support me, since I'm pretty busy these days, but definitely working with a lot of cancer patients.
Thank you for sharing that. So you've helped many, many, many get to deeper root causes and varied issues of what's going on. And we've discovered discussed most of your approaches. Is there anything that we've left out? Is there anything else we need to cover here on how you address that?
Well, I think one of the critical things about an approach is really allowing a holistic thinking healthcare team to prioritize a protocol. Because what I'm finding in this day and age, and Dr. Google, is that people can get access to information everywhere, but I would encourage people to still use someone that you feel comfortable and confident with, that you can, get access to, and you trust their training and their learnings, and it's congruent with, what your heart and mind is telling you to go forth. And we really work with the gut and opening up the pathways of elimination and helping with detox before we do really aggressive therapies, or just therapies that don't really look at lifestyle and diet and nutrition. That's a very critical and fundamental part of our work in naturopathic medicine, and especially in the way that we practice here at Options.
All right, thank you for sharing that. You also have a heart-based meditation that is, I think people can access that through a website. And so I'd like to know, why did you start that? What is it about? And how can they get that?
So it's kind of funny, because right when I decided to study natural medicine specifically was exactly in the same week that I discovered this heart-based meditation practice. To me, that was no accident. It all just kind of came and opened up. And I was very fortunate to have found this heart-based meditation back when I was 21 years old, and just thought, this makes complete sense. I want to do this. I had tried to meditate before, but I couldn't really do it on my own. And this system, it's called Heartfulness. It has a technique called cleaning. And the cleaning really facilitates all of us to have a tool that we can do on our own to help clear our minds. So the mind, its natural state is to think. And what we want to do is not let the thinking monkey mind rule our lives, but rather bring it back to the heart. So the cleaning facilitates the removal of impurities and complexities. In fact, your guests can just simply go to YouTube and type in Heartfulness cleaning, and there's a little, 5-minute video that tells you how to do it. And it's a practice that I actually give to a lot of my patients to do when they're either anxious, or they can't sleep, or they can't settle, or they have monkey mind, or they have adrenal issues. So you do this cleaning once a day, ideally, 15, 30 minutes, and then you imagine source entering from the front to fill that void that you've created. So that's one half of a daily practice, where the other half is that we meditate on the heart in the morning. And the thing about this particular system, not only is it this cleaning that's very unique about it, but it's also that there is a transference of that divine or that source energy when we do that meditation. And part of the system is to meditate in a group or meditate one-on-one with a trainer. And the trainers are prepared to allow that pranahuti or that divine transmission to flow through them. So it's not coming from us or whoever the trainer is. It's coming through us from that divine source, but it's a way of specifically awakening and helping open up what's already inherently present in any person's heart. So the thing that I really love about Heartfulness is that it absolutely mirrors the universal truths we see in homeopathy, because it's about coming to the surface and releasing and letting go. And there's even a term for that in this system. They call it BOG, B-H-O-G. BOG is, it's your BOG when you're going through a difficult experience, because you're undergoing it in order to have it leave you.
Awesome. I like that. Yeah. So Heartfulness, they can find it on YouTube, and they can also go to www.heartfulness.org to find this meditation.
Yes,
awesome. You have provided a wealth of information. We've had a great overview of the Gestalt therapy approach and how important that is for our viewers to think about sensations in their body, and maybe instead of notice them more and become like, okay, well, maybe why am I having that? And maybe try to figure out how they can release that on a small scale. If you, viewers, if you have anything larger that you're going, wow, I'm really anxious all the time, then go seek out a medical professional, please. And then we've also talked about German New Medicine, recall healing, and the brain protocol. Those were all interesting and how they all work and interact with our mind-body connection, and the view of that you address as naturopathic and homeopathic approaches, and that's wonderful. I believe you have a free gift. You mentioned it a few minutes ago of what they can receive from you, and so I'd like to know what that is and how can they find it.
Yeah, so as I mentioned, we have this page that explains basically what those organotherapy homeopathic remedies are for those first 3 weeks of the brain protocol, and how to take it. And it's a very simple protocol, and it's a 3-month cycling through, 3 weeks on, 1 week off, where you cycle through the 3 initial weeks of that development. And it's something that, generally, as I said, just about anyone can do. One of the things that it states on there is for folks who are, like if you're going to use it in a child, it's something we use a lot in children with, anything from ADHD to autism to someone who's even having some gastrointestinal issues. You would only give the week that corresponds up to that child's age, but that is also printed on that PDF document that's available on my website.
Thank you for that information. I've really enjoyed having you here today, and I myself have learned a lot, and I'm sure our audience has plenty of takeaways. And audience, I want to thank you for being here today too.
Thank you so much, Cathy. I really appreciate it.
Oh, you're quite welcome. Thank you. Bye-bye, audience.